Hi. So I'm Jennifer Lucas. I'm a pharmacist and I'm one of the instructors here at MATC for pharmacy technician. And I guess if you could show the next slide. So back one slide, sorry. Thank you. So what is the role of the pharmacy technician? It's, you might have seen pharmacy technicians when maybe you get your own prescriptions at the pharmacy or prescriptions for family members. But the technicians can be really anywhere medications are. So you might see technicians in a hospital or other settings. But the main role of the technician is to assist the pharmacist in getting patients their medications, really. So that can come in a lot of different ways. Another really awesome thing about working in the pharmacy is you're part of the entire healthcare team. So if you're not really sure like what part of healthcare you want to work in, I really think pharmacy is a great place to start because you get to see how all the different pieces of the puzzle of the healthcare team come together. Because ultimately, most patients need medications, and so then you're kind of helping them in all those different facets of healthcare. The technicians do a lot of work with putting the medication order together. So sometimes that's as simple as like putting a sticker on a bottle, but sometimes it's as complicated as a very technical skill of making a sterile IV preparation for a patient that's going into surgery. So there's a lot of skill involved in some of those higher technical orders, but the orders you mainly see like at a community pharmacy, technician probably put that together. And really it's just the pharmacist checking that at the very end. So the technicians are really in charge of almost the entire assembly line of putting medications together. One of my favorite parts about working in a pharmacy, at least the pharmacies in my community, is I get to help the members of my actual community, and you get to build relationships with them, and they come to you for advice and support, and you really get to help see that impact over month after month when they're coming in for their prescriptions. So it's a really I feel really privileged to be a part of that, and that patients allow me to help them with their health. So if you could go to the next slide, I'll talk about some of the other settings that maybe a pharmacy technician would work in. So the picture shows a technician making a sterile preparation. That is a course that we teach at MATC. So you're trained from how to hold the needle all the way to the end of making the product for the patient. And this is the main task of many pharmacy technicians in hospitals. They'll spend most of their day making these type preparations for patients. So if you were a technician in a hospital, this would be one of your main roles. But you can also work in a pharmacy that deals with just health insurance or prescription insurance. So you would have like working in an office, like with cubicles and things like that, or mainly in front of a computer screen. So you're not always in direct patient care. You're handling a lot of the financial aspects of pharmacy. Long-term care is another aspect that a setting that a technician could work in. And that's more of like an off-site where you, again, aren't doing a lot of patient care, but you're still putting those prescription orders together in a very technical way. And then the next slide, please. One of my other favorite things about working in pharmacy is there's so many different places that you could work. Many of those could be in your community, right down the street from where you live. Pretty much anywhere you move, there's going to be a pharmacy because people need medicines. But within whatever path you choose, there's a lot of different opportunities for growth and specializing, especially as pharmacists become more specialized. Now technicians are kind of filling the needs that the pharmacists have left behind of some of these like really highly trained areas that technicians move into in what's called a career ladder. So once you start out in the pharmacy, that's not the end. You can keep growing your career and keep moving forward in the different areas that you could specialize in. And the last slide.
That's awesome.
So the program at MHEC is 2 semesters for pharmacy technician. The first semester we focus mainly on community pharmacy, so like the pharmacies you'd see in your neighborhood. On the second semester is hospital pharmacy. So those are kind of like more behind the scenes roles that maybe you haven't seen before, but very important. We are at the downtown area, downtown campus, and all the instructors in the program are pharmacists and technicians. So you get a lot of the hands-on and real life stories.